Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. I hope you all are fine. Welcome to the dietary modification. Before I start my discussion, I want to define about the dietary modification. What is dietary modification? Dietary modification is the modification in the diet during the processing, preparation, and consumption of food to increase its bioavailability and reduce the micronutrient deficiencies. Before I start my discussion, I want to say that please like and subscribe my channel and also press the bell icon to never miss my upcoming videos. And if you have any query regarding my this topic, and if you know about the upcoming videos, and you share your opinions, and if you want to need a customized diet plan, please contact me on this contact number which I mentioned in the description box. The topic of my discussion is today the fatty liver disease, which is a very life threatening disease nowadays. Here you can see the two pictures. On the left side there is the healthy liver, which color is in dark brown color, and on the left side there is the fatty liver. On the fatty liver there is the fat deposition occur, and this is a very life threatening for the liver diseases people. The definition of the fatty liver disease is that the storage of extra fat in the liver. Fat reaches 5 to 10% of your liver's weight, which is very life threatening nowadays. Steatohepatitis. Steatohepatitis is the disease in which the buildup of excess fat in the liver cells. Fibrosis. Fibrosis is the disease, the development of fibrous connective tissues as a reparative response to injury or damage. Cirrhosis of the liver. Cirrhosis of the liver is the disease in which the scarring may occur on the liver. There are two forms of the fatty liver disease. One is the alcoholic liver disease. It is the accumulation of fat in the liver as a result of the heavy drinking. 5% of people in the US have prone to this disease. And the second one is the non-alcoholic fatty liver disease. 1 in 3 adults and 1 in 10 children in the United States may suffer from this disease. People who aren't heavy drinkers may prone to this disease. This is a picture of the stages of the liver, in which you can see that there is the healthy liver and the second one is the fatty liver. Obesity causes fat deposits in the liver. Dark skin coloration is also the cause of this fatty liver disease, and cirrhosis may also occur. Scar tissue develops over time. First one is the liver cirrhosis, second one is the non-alcoholic fatty liver disease, and third one is the autoimmune hepatitis, and fourth one is the most serious and life-threatening disease, peripheral neuropathy. The causes of the fatty liver disease is being obese or overweight, having type 2 diabetes or insulin resistance, having metabolic syndrome, and the certain prescription medicines such as Cordarone, Cardizem, Nolvadex, etc. This is the causes of the fatty liver disease. Here I shared the picture of the causes of the fatty liver disease, in which the first one is the genetic inheritance, second one is the obesity, third one is the side effects of medications, fourth one is the rapid weight loss, fifth one is the fat in the blood, and the last one is the diabetes. Now the symptoms of the fatty liver disease is the abdominal pain, nausea, loss of appetite or weight loss, yellowish of skin, which is commonly known as jaundice, swollen abdomen and legs, edema, weakness, extreme tiredness or mental confusion. Here you can see the symptoms of the fatty liver disease. Now move towards the diagnosis. Diagnosis of fatty liver disease. Ultrasound or computed topography, which is commonly known as a CT scan. The laboratorians needs to know about the picture of the liver. Liver biopsy is the second one. In the liver biopsy, to determine how far advanced liver disease has progressed. In the third one is the fibroscan. In the fibroscan, the laboratorians find out the amount of fat and scar tissue in the liver. Here is the picture of all the procedures of the diagnosis of fatty liver disease. The most important part of my discussion is the medical nutrition therapy for the fatty liver disease. The patients who suffer from the fatty liver disease, the diet low in calories and rich in unsaturated fatty acids and rich in natural antioxidant may be prescribed, which is enriched in vitamin A and vitamin C. According to the nutritional recommendations for patients with non-alcoholic fatty liver disease, the carbohydrates should comprise 40 to 50% of total dietary energy. Aerobic exercises improves the metabolic parameters. 20 minutes of aerobic resistance training 3 times per week was more effective for reducing non-alcoholic fatty liver disease biomarkers in adolescents. Vitamins and mineral supplementation may also be needed by this patient. Vitamin E has been studied most in relation to non-alcoholic fatty liver disease. Many small studies conflicting results with vitamin E doses between 300 and 800 IU per day because its increased risk of hemorrhagic stroke and all-cause mortality. Ginger is very beneficial for all the diseases as well as fatty liver disease, can improve insulin sensitivity and reduce hepatic fat content. Limit the consumption of all added caloric sweeteners, including high fructose corn syrup. 15% of total calories from lean and vegetable protein is recommended. Consumption of sugar containing beverages is a significant predictor of non alcoholic fatty liver disease. Both beans and soy have shown promising results to reducing the risk of non alcoholic fatty liver disease. Greens vegetables, possibly due to the nitrate and distinct polyphenols found in the leafy green vegetables, may be beneficial for the fatty liver disease patient. Soy contains a higher content of protein B conglycinin, noted for its bioavailability to help lower triglyceride levels and protect buildup against visceral fat buildup. Coffee consumption is associated with the lower risk of developing non-alcoholic fatty liver disease and may also reduce the risk of advancement of liver fibrosis. Tofu is a low-fat food that serves as a good source of protein to limit your fat consumption. A diet may rich in nuts is associated with reduced inflammation and the lower prevalence of non-alcoholic fatty liver disease. Omega-3s fatty acids may benefit those with non-alcoholic fatty liver disease as well as reducing liver fat, boosting protective HDL cholesterol, and lowering triglyceride level. Whole grain fiber rich foods like oatmeal are associated with the reducing the risk of non-alcoholic fatty liver disease. Alcohol can be a major cause of fatty liver disease. Fried food also be restrict in patient with the fatty liver disease. Sugary products like cookies, candies, sodas, and fruit juices may also reduce in fatty liver disease, and it also the cause of the amount of fat buildup in the liver very harmful for this patient. Beef and dairy meats are high in saturated fat. That's why this also may restrict to this patient. White flour is typically high processed. May also increase the risk of fatty liver disease, and many other issues can also raise to intake of the white flour, like blood sugar level may elevate it. Here I share about the fatty liver diet chart. The fatty liver patient's calories is around 1800 kilocalories, and the nutrients also mentioned here. The calcium is 600 milligram. Sodium may recommend about 1200 milligram to this patient. 420 milligram of carbohydrate, 80 gram of protein, 17 milligram of iron, and the total fat is around 20 gram. Here the diet chart with the timings mentioned for the fatty liver disease patient. Tips to prevent fatty liver disease from in the first, limit intake of saturated fat and trans fats because already the patient with fatty liver disease may prone to deposition of fat on the liver. Eat a balanced diet to feel the relaxation and healing process. Limit consumption of refined carbohydrates. maintain a healthy weight because obesity may also prone to this disease. Quit smoking, exercise regularly, limit or avoid alcohol, take medication as prescribed. Here I share my important information, which is the diet plan sample, and you can also contact me with me for the customized diet plan about any of your diseases. Then the breakfast and the 8 hours of hot meal mixed with 2 tablespoon of almond butter, 1 tablespoon of chia seeds and 1 cup mixed berries, 1 cup of black coffee or green tea. In the lunch, the spinach salad with balsamic vinegar and olive oil dressing. As I told you earlier, that greens vegetables may rich in nitrate and distinct polyphenols, which is very beneficial for the fatty liver disease patient. 3 ounces of grilled chicken or 1 small baked potato or 1 cup of broccoli, which is cooked carrots or other vegetables. In the snacking, the 1 tablespoon of peanut butter on sliced apple or 2 tablespoon of hummus with raw veggies. In the dinner, the patient with fatty liver disease may take small mixed bean salad or 3 ounces of grilled salmon or 1 cup of cooked broccoli or 1 cup of cooked quinoa or 1 cup of mixed berries. This is the diet sample for the fatty liver disease patients, and this patient may also take small meals instead of the large meals. Here I share the information about the liver disease, in which the patient may need of the some nutrients which is beneficial for the fatty liver disease patient and also reduce the risk of fatty liver disease and other diseases, which is omega 3 fatty acids, vitamin P, flavonoids, vitamin E, vitamin C, fiber, vitamin A. Here I shared the remedy which this disease patient can easily take at home, like papaya to treat fatty liver disease. In the first, the take 1 tablespoon of fresh lemon juice. In the second, grind 5 to 6 dried papaya seeds and mix it. In the third and last, the take this 2 times a day for 1 month to the proper healing of the fat deposition in the fatty liver disease. And non-alcoholic fatty liver disease, excessive fat buildup in the liver that is linked to a person's diet, not their alcohol consumption. Here I shared the information about these supplements which may take by this patient. In the first, the O liver tea capsules, the liver MD milk thistle is very good for the fatty liver disease patient. Stream X detox, and in the last, the fatty liver disease patients may also take the cod liver oil, which is best for the healing of this disease and reduce the fatty liver disease as well. This oil may add in the daily cooking, like 1 tablespoon, and also may do the dressings when they take the salads. Thank you so much. In the last, I want to say that again, please like and subscribe my channel and press the bell icon to get notified about my upcoming videos. And if you have any query regarding this topic, and if you need of a diet plan, please contact me on this contact number which I mentioned in the description box, and please respond me in the good way. Thank you so much. Allah Hafiz.